Restless leg syndrome affects about 13% of Americans. It occurs in all ages, so we know that even children, about 2% of them will have restless leg syndrome, be able to identify and be diagnosable by the four clinical criteria. We know that that number does increase in middle adulthood a little bit, and we will see that even in pregnancy, we might see some studies even showing up to about 80% of women will experience some restless leg syndrome during pregnancy. And then we also see it pick up a bit more again once we see ages of about 55, 60. So we definitely see restless leg syndrome almost up to even about 20% in the older age group. It's important to recognize and diagnose restless leg syndrome appropriately. So there are four clinical criteria that we are looking for. One is the urge to move. And most people are going to recognize that or be able to articulate that this occurs in their legs, but we have to remember that it can also occur in other body parts. So, up to about 50% of people might even have some restless arms, restless torso, restless body. The other clinical criteria is that it tends to be worse in the evening, so it definitely has a circadian component to it. We also know that it's better when people are walking, moving, stretching, rubbing their legs, massaging, taking a warm bath, doing things that might help distract from that sensation. And then, of course, if they try to lay down or rest, let's say in the evenings after dinner, maybe they want to watch a movie, watch TV, read a book, that's when it seems to get more active. And especially for some people, it occurs just as they get into bed to go to sleep at night. And so then it can be a large cause for insomnia. So there are four clinical criteria to diagnose restless leg syndrome, and it's based on their symptoms that the patient is describing or has. So we want to make sure that we ask them, do they have this urge to move their legs, typically in the evening hours? And sometimes they'll also tell you it's an uncomfortable sensation. So it could be creepy, crawly feelings. It could feel like rubber bands inside their legs stretching back and forth. It could feel like sometimes people describe an achy sensation. We know that there is a painful variant for restless leg syndrome. So that's where sometimes it will come up while we're discussing other reasons that the patient might be in the office for. So somebody might come in for evaluation of neuropathy or pain, and we really need to be thinking about also asking for those four clinical criteria for restless leg syndrome. It's possible they could have both. It's possible that they actually have restless legs and not something else. But I think the most important thing is that we've really got to dig in a little bit deeper and ask those questions. Now, with restless leg syndrome, there is no blood test or scan type of test that we would do to diagnose it. So it's really based on their clinical symptoms that they describe in the office or that we ask the right questions to get the responses.